This is part two of our presentation, Adjustment Quotient of the Elderly for the Social Sciences Conference 2011, presented by Dr. Bishnupriya Dasgupta and Shilpi Malhotra. Once again, we apologize for the segmented nature of this presentation, but being a YouTube presentation, it had to be divided at the 10-minute mark.
The study clearly indicates that the elderly accept the inevitability of reduction in social and personal interaction. This disengagement theory, as put forward by Cumming and Henry, suggests that elderly are more satisfied when they are disengaged. Sannyashram, the fourth phase of Indian life cycle as described in Hindu religious philosophy, is believed to be a life stage where the elderly should disengage themselves from worldly affairs and strive towards activities that lead to the spiritual world with the ultimate goal of achieving self-realization or nirvana.
The suffering of old people is sometimes unrecognized because we assume that it is natural for this to be a time of low spirits. Depression is one of the most common expressions of emotional distress among the elderly. In this study, signs of distress were significantly visible among the elderly. Family members and society at large need to be sensitized regarding emotional distress indicators, and corrective measures need to be taken.
The need and dependence on the spouse was found to be absolute among the elderly. It was observed that years of togetherness had created a noticeable decline in communication and interest towards the spouse.
Elders with spouses were concerned about their appearance, took efforts to look young, and maintain a positive attitude towards life. They were also concerned about the spouse's well-being and if they were being properly provided for.
It was found that economic insecurity and dependence was prevalent among half of the elderly population who were obliged to stay with their family as dependent parents. They did not have the means to opt for an old age home or visit daycare centers. As compared to men, more women were economically independent because they outlived their spouses and were provided for by their spouse's pension.
The study found that elderly realized that it was financial independence which gave them power and prestige and the means to engage in activities of their choice which helped in better adjustment.
There is a significant relationship between financial independence and life satisfaction. Half of the elderly population were financially independent and maintained a positive outlook on life. In India, there is no social security program, which means the elderly have to provide for themselves. The lack of government-sponsored programs for the elderly may mean physical, social, or psychological strain on the elderly unable to provide for themselves.
Life satisfaction refers to retrospective evaluation of life happiness through self-judgment. It is a composite index of our adjustment. The elderly in India are going through a transition phase. There are a significant number of elderly who are among the last generation to enjoy the benefit of getting pension throughout their lives. Later generations will not have this benefit as pension schemes are no longer provided to workers. With no government social security program, we conclude that the life satisfaction index of the elderly will decline very fast. The government and society need to act immediately to provide for the elderly so they will experience an optimum level of physical, social, emotional, and economic well-being.
Happiness among the elderly in Indian homes is best when they visit daycare centers. There was a significant finding for those elders who had constructive schedules during the day and felt safe and secure among their family at night. Without recreation, this happiness quotient has a significant decline. The elderly find it difficult to adjust to a life situation without recreation. The findings indicate that their happiness quotient is comparable or lower to those elders in old age homes.
since the adjustment quotient among the elderly was found to be the highest when they visited daycare centers, took part in the activities while living with their families, it is recommended that it should be mandatory for all residential areas to have a daycare facility for the elderly within their property that is easily accessible and affordable.
Daycare centers should be affordable, well maintained, and fit the living standards of the demographic population of that area. There is often hesitation and reluctance on the part of an individual belonging to a middle-class socio-economic status to visit a center catering primarily to an upper-class clientele.
Theoretical models have explained life satisfaction on the basis of disengagements or activity. While the disengagement theory have their merits, there is a growing body of research that supports activity theory, which emphasizes that old people who live an active life derive greater satisfaction from their life. This study also conclusively supports the theory and emphasizes that the elderly who were actively visiting the daycare centers and involved in their activities were the most well-adjusted group within the research sample.
Research shows that the elderly enjoy the company of children and their relationships create mutually beneficial environments. It is therefore recommended that orphanages and old age homes be located in close vicinity to create foster grandparent programs. This relationship may benefit the adjustment quotient for both the orphan children and the elderly.
Elderly people may have learned skills which they had not used during the course of their working careers. Engaging in constructive projects or hobbies may help improve adjustment quotients. In India, the continuum of services for the elderly, such as daycare, community care, or partial institutionalization that are provided in developed nations are yet to be established. There is a heavy dependence on family as a provider of financial and emotional need. Providing facilities, services, and a social support network for the elderly will help ease this dependence.
Healthy aging is not only related to the advances in medical technology but also to a wide range of other factors like enabling the elderly to lead a stimulating life, being involved in society, and having meaningful social relationships. Health is the greatest resource that determines adjustment to aging. Optimal level of health and physical functioning, absence of disability, and possibility of mobility determine life satisfaction of the elderly.
There is no comprehensive database existing in our country covering all aspects of aging. A compilation of activities, especially meant for the elderly, and outreach within the elderly community about these programs and services is an important aspect of getting involved elder citizens. As a measure to increase participation, programs with subsidies and concessions should be offered.
The image of aging exists at the individual and societal levels. Well-adjusted individuals perceive themselves as friendly, wise, alert, adaptable, and competent. At the societal level, it is important not to attach a stigma to aging and respect the life stage and challenges of the elderly.
Thank you for listening to this presentation. Please feel free to contact us with the information on this slide for any additional information that you may need.